Hello, everybody. Thank you all for joining us today. I'm Congressman Colin Allred, and I'm proud to serve as the Vice Chair of the Congressional Black Caucus Foundation Board of Directors. And I'm also the representative for Texas's 32nd Congressional District, where I was born and raised here in Dallas, Texas. I'm so glad to be hosting this panel today on strengthening Black families by passing a national paid leave policy. I'm honored to be joined by Dr. Kimberly Jeffries Leonard, who's a member of the Board of Directors for the American Cancer Society Action Network, and Jocelyn Fry, a senior fellow with the Women's Initiative at the Center for American Progress, here representing the Paid Leave for All campaign, and Nellie Cuenca, a fellow North Texan and friend of mine and founder of MAPA, the nonprofit in Dallas that we'll learn a lot more about. As many of y'all know, passing a national paid leave policy is personal to me. It's one of my top priorities. Earlier this year, I took a month of leave to be with my family after the birth of our second son, Cameron. And in 2019, I did the same when I took a short leave when we had our first son, Jordan. I was actually the first member of Congress to take paternity leave, something I didn't know I would be the first when I did that. And I want to make sure that the overwhelming benefits to the entire family, the peace of mind and the financial stability that having paid leave can bring is available to every American, no matter who you are, where you live, or what job you have. But right now, that's not the reality for most Americans, especially Black and brown families, because we are the only country of our 41 peer nations that doesn't have a national paid leave policy. According to studies, 4 in 5 workers in the private sector have no access to any paid leave, that number rising to 95% for the lowest wage workers, who are more likely to be women or people of color. A 2018 study by the National Partnership for Women and Families showed that this lack of access to paid leave also contributed to the racial wealth gap. And the group argued that a smartly constructed national paid leave policy would help reduce some of the health and economic disparities experienced by people of color in the United States. And this pandemic has only made this more urgent. It's estimated that 2 million women have left the workforce as a result of the pandemic in order to provide care to their families or their kids who are at home, or to take on other of the invisible labor tasks that so many women do every single day. And these realities are unacceptable in the United States of America, and we have to do something about it. This past year and a half, we've seen the essential value of all of our frontline workers, from grocery clerks to ICU nurses, and we spent a lot of time in each other's living rooms, like we are right now on Zoom recordings. I think we now have a greater understanding of the need for us to support our most vulnerable workers and families, to be flexible with one another, and that we all have home lives that need attention and support as well for us to be productive in the workplace. That's why I'm proud to fight for a national paid leave policy alongside President Biden and my colleagues in the Congressional Black Caucus. The president proposed 12 weeks of paid leave in his investments in our nation's workers, caregivers, and families. And I'm ready to do all that I can to make sure that we get this done urgently. We have made some progress helping families. Earlier this year, I was proud to vote to support the American Rescue Plan, which included an improved and expanded child tax credit, which has already had 2 monthly rounds of up to $300 per child go out. It's gone to millions of families across the country, and it's already having a big impact. You know, as a dad of 2 young children, I know how difficult this pandemic has been for families with young kids, which is why we did all we could to support them in the American Rescue Plan. This groundbreaking program is basically a tax cut for middle and lower income families that puts money back in their pockets, and it's going to cut childhood poverty in half. That's a big deal. I was raised here in Dallas by a single mother who was a public school teacher, and I know what it's like to have to figure out each month how to pay the bills. And I think that these common sense changes are already making a huge impact for so many families like the ones that I grew up in. And we have to make these changes permanent. That's something we're working on right now. We still have a long way to go to make sure our policies are caught up to the reality of American families, especially Black families. And I'm committed to doing all that we can to support these hardworking Americans. Now, I'm so glad to be joined by our panelists to discuss how we can pass policies like paid family leave to invest in our families and our caregivers. I want to start by introducing Dr. Kimberly Jeffries-Leonard. Dr. Jeffries-Leonard is a member of the board of directors for the American Cancer Society Action Network, and she's a leading advocate for passing a national paid leave family policy through the ACS's newly formed Patient Advocate Coalition. Dr. Jeffries-Leonard, I'm so happy to give you the floor to help kick us off.
Thank you so much, Congressman, and thank you for your story. I think that's really very important for us to hear. And it is interesting that you were the first member of Congress to do that. So thank you for leading the way. I am very pleased to be here to represent the American Cancer Society Cancer Action Network on this very critical issue. The availability of paid family and medical leave for people with and caring for individuals who have a serious illness or health condition is vital. Treatment for and recovery from serious illnesses and conditions are often difficult and time-consuming, and many of us know that from personal experience. The American Cancer Society Cancer Action Network is calling on Congress to enact a national paid family and medical leave program, and it is critical that Congress considers this program because it includes paid leave benefits for individuals with serious illnesses and health conditions and caregivers. We know this is an access to care issue and one that has broad implications for health equity. The flexibility to balance treatment and employment is essential for patients and caregivers. Multiple studies show that cancer patients and caregivers who have paid leave have higher rates of job retention and lower rates of financial burden than those who do not have access to paid leave. We know that not all patients or caregivers have access to paid family and medical leave, and without it, just to care for their family members, they risk financial hardship or not getting the care they need or the care that their loved ones need. Fewer than 60% of workers qualify for job-protected, unpaid leave under the Family and Medical Leave Act, and workers of color and low-wage workers and single parents are always disproportionately excluded. So in response to this dire need, as the Congressman said, the American Cancer Society Cancer Action Network has convened a coalition of 30 patient advocacy organizations and other concerned stakeholders to advocate for paid medical leave for patients and their caregivers. We have members which include the Black Women's Health Imperative, the AIDS Institute, the Cancer Support Community, the National Multiple Sclerosis Society, the Epilepsy Foundation, the Muscular Dystrophy Association, Women Heart, the National Coalition for Women with Heart Disease, and so many others. We thank them for their engagement because this coalition will evaluate paid family and medical leave legislation through the lens of consensus policy principles and will advocate on Capitol Hill and with the administration to ensure that the voices of patients are heard in this conversation. People of color with lower incomes who are disproportionately impacted by many of the diseases our coalition groups represent. These are the ones that need to have paid medical and family leave, and they are the ones that are least likely to get it. So we're asking that Congress enact this national paid family and medical leave program with the needs of patients and their caregivers in mind. We know that this is critical for the health of our nation. And I thank you, Congressman, for having me here today. And I'm happy and looking forward to this discussion and talking and answering any questions that you may have.
Oh, well, that's great. Thank you so much, Dr. Jeffries-Leonard, for joining us and for all the important work you're doing to help us make a national paid family and medical leave policy a reality for all Americans. I know it's going to take leaders from every section of our country to get a policy like this into law, which is why I'm proud to introduce our next guest, Jocelyn Fry from the Women's Initiative at the Center for American Progress, here on behalf of the Paid Leave for All campaign, and to talk a little bit more about the disparities that Black families face in accessing paid family leave.
Thank you so much, Congressman Allred, for really convening this important discussion today. And your commitment to making sure that all families, particularly Black families, have the care that they need. I am Jocelyn Fry. I'm a senior fellow at the Women's Initiative for the Center for American Progress. I'm also here representing the Paid Leave for All campaign. It's a campaign that is fighting for comprehensive paid family and medical leave for all Americans, because we know that the need for care eventually touches every family. Today's conversation that focuses on the particular need for paid family leave for Black families is quite frankly timely and long overdue. As you pointed out, as we recover from the devastation of the pandemic, what we know from the past year is that the lack of robust work-family policies really left too many families on their own. And that is particularly true for Black families and Black women who have been especially hard hit. What we know from the pandemic is that Black communities and Latino communities in particular were disproportionately more likely to contract and die from COVID. And on top of that, the school closures and the closures of childcare facilities meant that too many folks were really on their own in need of care. And at the same time, we know that Black workers and Hispanic workers are far less likely than white workers to have the flexibility that they needed to be able to work from home. So it was indeed a perfect storm. We also know from CAP analysis of the household pulse survey data that the Census Bureau produces, collected from May 2021, that 29.4% of Black workers and 32.9% of Latino families were more likely to report that somebody in their household had to take unpaid leave because of some sort of childcare disruption. So we know this is affecting families. And these care dilemmas disproportionately fall on Black women. Black women, like most women, are really tasked with doing the caregiving for their families, but they also have the highest labor force participation rates among all women. So what that means and what that dynamic is that Black women are working more, but they also have family needs. And it is a challenge to try to balance both. So the need for work-family policies that are responsive to those needs is enormous. For Black women, the decision to participate in the paid workforce is not an option, it's a necessity. Again, CAP analysis from 2015 to 2019, current population survey data found that 68% of Black mothers were either the sole or primary breadwinners for their families more than any other group of mothers. Similarly, CPS data from 2018 shows that amongst Black families that households headed by Black women, 41.2% of them represented Black family households. So Black women are heading a sizable percentage of Black families. Again, that's more than other women. And so the data make clear that the economic contributions of Black women are really vital for their families. At the same time, again, as you pointed out, Congressman, many Black families have been affected by the high demand for care workers, who often are Black women themselves. And although we talked a lot throughout the pandemic about the essential work of care workers, the harsher reality is that we pay them very low wages and they often don't have the work-family supports that they need. As I think Dr. Jeffries pointed out, in addition to that, low-wage workers, generally speaking, have less access to paid leave. So workplace policies like paid family and medical leave are really critical. They help families accommodate their work and family obligations. That's particularly important for Black families. It also fills a critical gap for families who don't have access to paid leave, and it promotes greater attachment to the workforce. And at the same time, Black workers, Black women can continue to grow their wages. It's also important to have paid family leave to counter these longstanding narratives about who is deserving of support and who isn't. Narratives that Black women have often experienced because they're expected just to be satisfied with any job, regardless of the quality, and to prioritize everybody else's needs and the job in particular ahead of their own needs. These assumptions have a long history. They're rooted in Black women's long history as care workers. But quite frankly, we need to get beyond those narratives. Without paid family leave, too many Black women are forced to juggle and debate between their own care needs and the needs of their work, their employers, and they put both their family's economic security at risk and their own and their own well-being. A national paid family and medical leave policy is a vital solution that can help Black families address their care needs without jeopardizing their economic stability. And lastly, let me just say that the time for change is long overdue. Policies that address caregiving needs should not be reserved for the privileged few. Black families, indeed all Black families, deserve the protection of paid family and medical leave. Thank you so much.
No, thank you, Jocelyn. The stats are clear, and we obviously have to act. And I think laying them out that way is so important. And last, but certainly not least of our panelists, it's my pleasure to welcome my fellow North Texan, Nelly Cuenca, the founder of MAPA, a nonprofit that supports single moms raising sons, something, Nelly, that I have some experience with. And Nelly, just thank you so much for being with us. It's good to see you again, and I'll turn it over to you.
Yes, thank you, Congressman Colin, Allred, and you are definitely the vision of MAPA. So MAPA is a nonprofit that focuses on moms who are raising boys without a father figure. The co-founder of MAPA is actually my 5-year-old son, Dean, and he coined the word MAPA. So MAPA is mama and papa. So I do play a full role, and many of the families, as we stated earlier, with paid leave, are affected by the economic disparities that we have mentioned, specifically with this pandemic. And so when we juggle our workplace, economics, and then our caregiver role, knowing that not many have family support, it is essential to have policy that helps support our mothers. And Colin, one of the things that I will say, I'm not the first or the last mom to raise a boy without a father. You can go anywhere internationally. You can find a MAPA boy in India, in France, in Mexico, Honduras, and Peru. We are an international community. So something that we pride ourselves on is knowing that you can visit anywhere in the world and you will find a MAPA mom or a MAPA boy. The common denominator is that we're empowering our communities to understand that together we're a powerful entity, and our voice can be the next Colin Allred, or the next President Obama, or LeBron James, or even, and I know many people probably know his music, Justin Bieber. And so when we look at the support and what it looks like, when we have a community that comes together and policy that supports our mothers, then we will raise an incredible gentleman that will lead our country and our communities to a better tomorrow. And Congressman Allred, I do want to say that relatively being the caregiver and the breadwinner in the household is very challenging. So I thank you for speaking out on the support. And I thank you for being that support to your wife when she gave birth, because we want and we need our men to lead and to understand that it's a bonding time for you with Cameron and your boys and your wife, and having that stability and having the possibility and opportunity to stay home and help is a big deal. And so when we talk about the mothers that we serve here at MAPA and the fact that they don't have a support system, and many times they are moving away from a toxic family environment and creating a new holistic approach and a new community for their boys, we need to understand that the support is needed for them to be empowered and in order for them to gain freedom and financial stability with a one household income and even a part-time job. So I thank you so much for giving us the opportunity to speak and to have this panel discussion today.
Nelly, thank you so much for the work you do. And, for the example you said, and, you're absolutely right. With the help of organizations like yours and hopefully policies like what we're trying to do, whether you're raised by a single mother or whatever your scenario is, you should be able to chase your version of the American dream. And that's what this is all about. That's what, I've been able to do. I have a lot of support from my community, but now we have to make sure that's available to more people. And so, let's go to the panel now and ask some questions. And Dr. Jeffries Leonard, I'll begin with you. You may not know this, but my mom is a breast cancer survivor. And so I know firsthand how tough cancer diagnosis can be for a family. My grandmother also had Alzheimer's and had to come and live with us, and when I was in middle school and high school. So I know and have seen how multiple generations of our family have been impacted by a serious medical diagnosis. And I know that this story is all too common across America, particularly in families of color. So, let's just start with this. How do you see universal paid family and medical leave helping folks manage the difficulties of caring for a sick member of their family?
I think that you hit on a very important point. This is something that most all of us have been touched by. And as each of our panelists said, when we look at access to care and being able to care for a loved one or yourself with a serious mental illness, Jocelyn broke the statistics down so beautifully. And Nellie told us how, impacts single family households. This particular legislation, Paid Family Leave Act, will help so many people of color who don't have access to being able to get the kind of care or take off. It will allow them to not lose their jobs. It will allow them to be able to address and get the care that they need without feeling as though they are going to be in dire financial straits. I've seen, I too, my oldest brother is now battling cancer again. And my sister-in-law is trying to deal with how she manages working and how she manages giving him the care that he needs. I too have had family members to be stricken with different kinds of illnesses that we've had to address. And if you don't have that safety net, then you're worried about, can I actually financially address this? What is my choice? Either I have to give care or I have to leave my job. So it really does allow for us to have a stronger United States, a stronger world, because our people are able, our people of color are able to have that safety net to be able to either give care or get care. And that's very important for us.
Absolutely. And, when you're talking about health disparities, we know that we have enormous health disparities in this country, but then you also have the same groups of the largest disparities in health having the least access to being able to take time off to care for their family. So it's as Jocelyn said, it's a perfect storm here.
It's a perfect storm.
And not perfect's not the word we want to use for it.
Right. But it comes together to impact us in so many disproportionate ways. If we're disproportionately impacted by these health issues, and then we're the ones that don't have access to care, are we not eligible for paid family and medical leave, then that becomes an issue that continues to keep us at the impacted economically, and impacts the disparities, it impacts equity, and it's a circle. It's a vicious circle and cycle that keeps on coming. I think that Jocelyn mentioned in her comments, in her brilliant remarks about essential workers. So during the pandemic, when you look at who was considered an essential worker, after we brought in the term and the definition of essential workers, our people of color were the ones that were the essential workers: grocery store, janitorial. And what happens when we have to provide care, or we ourselves are stricken with an illness? We don't have that safety net. And then the equity, the disparities continue to come. So this policy is very critical for us.
That's right. Well, thank you so much, Dr. Jeffries-Leonard. Your insight is really important here. And, Jocelyn, let me go to you next, because broadly speaking, Black workers and other workers of color lack access the most to paid family leave. And could you just speak broadly to what this would mean for the average Black family? How does this impact, wage workers who are overwhelmingly people of color versus salary workers? And a little bit about how this could be beneficial to the Black business owners who can now allow their employees to take paid leave, maybe making them more productive in the workforce.
Well, absolutely, and it's a terrific question. As several of us have mentioned, one of the big picture issues of concern is that for many Black workers, they are far more likely to be in jobs that are low paying, and we know that those low paying jobs often don't have access to things like paid leave. And what we know from the data is that the loss of of wages for workers who don't have paid leave is enormous. CAP has done analysis of this and looked at data from 2009 to 2018 and found that there was more than $22 billion in lost wages due to the lack of paid family and medical leave. There's also some research that looks specifically at Black and Hispanic workers and finds that the fact that folks may have to take only unpaid leave leads to a greater likelihood that those workers, those Black and Hispanic workers, are more likely to fall into poverty, under 200% of poverty. So the absence of paid leave has enormous economic consequences. There's also some research that suggests that if you look at full-time workers, a Black worker could lose as much as $8,000 over the course of the year if they have to take 12 weeks of unpaid leave. So the implications of having paid family leave are enormous. The other thing I would say in response to your question about businesses is that, many small business owners themselves say they want a national program because they simply can't afford to provide paid leave themselves. The Main Street Alliance is a partner and on the steering committee of the Paid Leave for All campaign. They did polling with over 1,700 small businesses, and what they found is they overwhelmingly support a national paid family and medical leave program. This is particularly true of businesses owned by women and people of color. Almost 80% of them, 78% of them said that they supported a paid family and medical leave program. The other thing I would say that's really important from a Black business owner perspective is we know that they are far less likely to have access to capital. We know that has an impact on their ability to survive. And because of that, particularly we've seen sort of the growth in entrepreneurship amongst Black women who own businesses, the lack of access to capital means it's even harder for them and creates further strain if they don't have the ability to provide paid leave. So it's really important for those business owners to have the ability to provide a support to their workers that they want to provide, but they are sort of foreclosed from doing so because they don't have the capital and the other sort of supports that are necessary. So we want our businesses to be strong. We want them to have access to policies that enable them to thrive. And it's why paid family leave at a national level is so important.
No, you're so right. And, I've heard people even saying that even with the vaccine, that, you hear that you might be sick for a day. And for some people, they can't miss a day of work, and so that's what we're talking about here is, the need to work every single day. And, when I was growing up, there's no way that my mom could have missed, 12 weeks of pay when we were already paycheck to paycheck. And I know, so many American families feel that way. But what it results in, is these stories we hear of, women having a child on a Monday and back at work on Wednesday. And when they're physically and mentally and emotionally not ready to be there, men, of course, having leave not even being a consideration for them. For me, since I didn't know my father growing up, I was always thought that I was going to be committed to making sure that I was there from the very beginning for my boys. But as I'm looking into it, I started learning about some of the research showing the overwhelming benefits to the entire family when the man is able to take leave as well. The child does better, the man is better, reports better relationships with his children, but also it leads to even greater gender equity in the home, which is not talked about enough with the invisible work that women do. And, when we're talking about Black and brown families and, we know how much of that, as you said, Jocelyn, is carried by Black women, both as the breadwinners and as the heads of households. So, this is, if you had to name a policy, this might be one of the ones that's been most impactful for us. And so thank you for talking about it. Thank you for bringing the receipts so we can have the stats to support what we're talking about here. And, I want to turn next to you, Nellie. We've talked about how I was raised by a single mom. We don't pay our teachers enough in Texas. And so that wasn't always easy. But could you just talk about what a policy like this would mean for the moms you work with, who are often on their own and maybe have limited support from family and friends, as you mentioned earlier?
Yes, thank you. Congressman Allred, one of the things that I do want to say is, again, our teachers are our heroes. They are the ones who create the next, change agents, our architects, our PRs, they are the heroes of our everyday lives. And when we had this pandemic and our teachers were virtually teaching from home, if you're a single parent and you're an essential worker or a nurse or a doctor or a CEO of a nonprofit and you're always on, the inability to not go to work is not something that's going to happen because you have to be in the office. One of the things that I do want to share is that the greatest barrier is the simple lack of understanding that our moms are the caregivers and the breadwinners. And so health, and even going to the doctor for yourself is a luxury. And as you stated earlier, when your mom was diagnosed with cancer and you were only in middle school, what happened to the mental health of the household? Because my son tells me anytime I get a flu or I have a sniffle, are you going to be okay, mama? Because he has an understanding that I am his only parent. And we don't have to go far. We can visit any shelter in Dallas, in Houston, in San Antonio, in California, anywhere. And those moms were one paycheck away from being homeless. And so when we look at our shelters and we look at relatively, we're paying very little attention to the work and family needs of our families, specifically in our Black and Latino community, as Jocelyn has stated, as Dr. Kimberly has stated, this disproportion. And health should never be a luxury. We should not have to think of, I have to take my son to the dentist and to his doctor's appointment. Therefore, I'm not going to be able to go to the doctor myself. I'm going to choose my son's health and I will prioritize my health later on. However, we know that if I'm not taking care of myself and being the caregiver and the breadwinner, then my household is at risk. So my hope with this is that we have workplace and policy support of notion of paid leave, because structurally we can do this together and we can be those change agents for our upcoming families in our communities. I truthfully believe that together we can establish, and combat our health and our economic disparities, specifically in the Black and Brown community, specifically for the moms that are mapas, that are mama and papa in the household. And I will say this, when COVID and this pandemic took hold, one of the things that I learned very quickly is that a mapa can become a mapa overnight. So we had a lot of women that their husbands, because of the pandemic, passed away with COVID, and their finances were up in the air because they were stay-at-home moms. So when we're looking at the research now, it's like how many women became mapas overnight? So for me, my story is untreated bipolar with my ex-husband. I now have full custody of my son. The judge terminated my ex-husband's rights and I don't have child support. So I am it for my son. So when I created this nonprofit, it was for women who had a boy and who wanted the best, empowerment for their son. Every woman has her own story. It could have been her husband died of cancer. It could have been her husband died of COVID. It could be our war. We have a lot of military families. The common denominator is we're raising boys to the best of our ability and we're empowering our communities. So I just want to say thank you. Yes to policy change. Yes to being change agents, and maximize our voices, Mr. Allred, because we need your leadership. So thank you again.
Well, thank you, Nellie, and thank you for talking about the role that single moms play in serving both as the mother figure, father figure, everything for their boys. I'm sure that being raised by a single mother has given me some insight into a belief system around gender equity, the need for us to raise up our women, but also that this is not going to just happen, that we have to have policies in place. People are struggling. They were struggling before the pandemic, and it has gotten much worse. And that's something that I sometimes get frustrated with in Washington. The discussion to me seems so far afield from what I know is really happening in communities. When the kids were home, for a year there, our son was home, from daycare from the pandemic. We took him out at the very beginning. And he was, I think, a little bit over one at the time when we took him out. And that was tough for us. And, my wife is a lawyer who can work from home, and I could do some work from home. I was still traveling to DC. But, that was tough for us. And I know so many families who cannot do that work from home. And my mom would have been one of them, right? And so it's been a very tough year. And I think that, we've talked a lot about infrastructure recently. The American Society of Civil Engineers has given our infrastructure a C-, right? That's what they gave us in terms of a grade. But if we were going to rank our human infrastructure in this country, it would be much lower, particularly for families of color and for women of color. And so we have to do a lot better than what we have been doing. And I think, as I said, the pandemic has exacerbated so many of the challenges that too many American families face, and access to affordable childcare, healthcare. Dr. Jeffries Leonard, you talking about the health disparities, the impacts of this. Ms. Fry talking about the overwhelming disparities that we're facing here, and of course, Nellie, with your work on the ground with mothers being impacted, I think we've had a good discussion of why it's so time that we pass a national paid leave policy. It's not a silver bullet. It's not going to fix all of our problems, but there's a reason why our other 41 peer nations have done this, because in my opinion, it's an acceptance of reality. I think most Americans understand that, when I was in the NFL, 100% of people got injured, right? That meant that at some point you're going to get injured. It just depended on what the injury was and when you got it. Well, in life, 100% of us are going to need some time off of work to care for a family member, for ourselves, for a child. And that, of course, has been just exacerbated by the pandemic. And so let's just accept reality here and then decide how we can allow our workers to be more productive in the workforce. Ms. Fry, you talked about small business owners who want to offer this. The big companies can, because they have the revenue and the ability to do that. Your small Black, brown business owner maybe can't. And so that's why having a national policy allows us to help them as well. And those workers are then more productive in the workforce. And so it helps all of us. And I think it's so important that we remember that. This is not a handout. This will actually lead to more economic generation for us. So with that, I want to thank you all so much for the work that you do, for the knowledge that you brought to this discussion. I am inspired and encouraged by your efforts. I want to thank you for helping us have, I think, a robust discussion of why this is so necessary and why it's going to take all of us coming together to get this done. And we have a chance now, in the coming months, to do something that I think will have one of the largest impacts on American families that we've done really since the Great Society, since the New Deal. This is the kind of scale of what we're talking about here. And when we do it, it's going to be because of advocates like you who are able to raise us up, give us the intellectual support for having done it, and really helping us understand why it's so necessary. And I'm certainly going to do everything I can. And I appreciate y'all so much for your time. So with that, I'll just end this discussion and say thank you, Dr. Jeffries Leonard. Thank you, Jocelyn Fry. Thank you, Nellie Cuenca, for joining us. And thanks everybody for watching.